been such a massive influx of people and far more appreciation for actually what we do, and actually more people are far more aware about what is actually involved in what we do, and it's far more complex than I think that what people actually realise. And it's been really good, really, really good for the cleaning companies across the country, I think.
Yeah, so a newfound respect for your profession.
Absolutely. Yep. Absolutely. Yeah.
So, what's how big a challenge has this been for you, Jane? This pandemic.
Oh wow. Okay, that's a really good question. I think for our company in particular, it's been quite huge. All of our staff are currently not working. So for us personally, we've taken a massive hit in terms of that. However, I'm still working with our commercial businesses who are still frontline and still essential workers who are still open. So we are still. I'm doing that personally, and for them in particular, there's been a massive ramp up in what they're doing across the board from head offices right across the country, which has been exceptional, the fact that they're actually taking this very seriously and actually changing things. For us in particular, we're an eco-friendly company, and so that's been something that's been huge for me, where we've had to change a lot of our policies around now using chemicals. We're using bleach and methylated spirits and plant-based disinfectants in what we do. And the PPE that we have now too has been massive. So just making sure that I'm in particular am taking responsibility for my own health and also that of the clients that we have has been really big.
Well, Jane, it's nice to hear you on the program, and stay well, stay safe, and well done.
Thank you so much, Wallace, for having me on.
Jane Naylor there, a cleaner in Invercargill from Little Green Ferry. And of course, I think, Michelle, wasn't it you that you started a couple of years back, a cleaner appreciation day?
That's right. I came up with this concept of Thank Your Cleaner Day for the very reason that was just articulated. Often cleaners are invisible to us. We don't appreciate the work that they do because it's often done at nights and at times when we're not there. So I think there has been an increase in understanding of the role of cleaners, and I know cleaners throughout the country have been having a very mixed time of it, because initially the demands were up, and then office buildings were being stopped, and so there was no cleaning going on, and then there's other organisations that need much more cleaning, like in our operation at the rescue helicopter, we've increased our cleaning. So, I think it is good for people to appreciate that these people are out there.
Final thoughts, Ian?
Yeah, I think it's been great that Joanna was there. What we are learning is that a greater appreciation for the frontline workers who are at supermarkets and everywhere else. And I've discovered a great appreciation for porridge every morning.
You've been wonderful. Ian Taylor, Michelle Bowe, go well. To Pizza Terra, have a great weekend. To all of you, I'm Wallace Chapman, back with you 3:45 Monday. Checkpoint is next.
Whakarongo mai koe ki te reo irirangi o Aotearoa. This is Checkpoint on RNZ National. I'm Lisa Owen. E haere aki nei, 2 more people have died from COVID-19. One is linked to the St Patrick's Day cluster, the other to Rosewood Rest Home. It's been 50 days since the first New Zealand case was confirmed. We look at what's changed. Will teachers be glorified babysitters and classrooms breeding grounds for coronavirus under plans to partially reopen schools at alert level 3? The Education Minister joins us. The government wage subsidy has topped almost $10 billion. We investigate who's getting it. And Big Pharma teams up to find a COVID vaccine while pledging not to profit from it. And how Kiwi ingenuity is keeping a 10-year-old and her best buddies connected via a 4-metre seesaw.
RNZ News at 5. No mai, haere mai. Good afternoon, I'm Paul Brennan. The government says there is time to iron out the kinks of returning some children to school under Alert Level 3. Early childhood centres and schools will reopen for children up to Year 10, but parents who can keep their children at home are being encouraged to do so. Principals are warning partial reopening could be a shambles and maintaining social distancing very challenging. Cabinet Minister Grant Robertson says schools will not open for pupils for at least a week after any transition to Level 3.
So if you think about where we are now in the best possible scenario, we're still 2 weeks away, effectively, from schools reopening. So there is now time to work through with teachers, principals, parents and students to make sure we can make this work.
The president of the Principals Federation, Perry Rush, says schools cannot plan if they don't know which students are returning.
I certainly do not think it'll be turn up if you feel like it on any given day. I think that is too difficult to resource in a school setting. So I think it will be important for schools and communities to understand that there will be needing to be a decision made about who attends and who isn't.
Perry Rush says schools also need to know what public health measures will be in place to ensure bubbles within schools are at a safe and realistic size. The Director of Public Health says 2 new deaths are a sobering reminder of the threat COVID-19 poses, particularly to elderly and vulnerable people. A man in his 90s who is linked to the Matamata cluster died yesterday at Waikato Hospital. And a Christchurch woman in her 80s who was among the group of residents moved from the Rosewood Rest Home died at the Burwood Hospital yesterday. Carolyn McElnay says 5 other residents from this group are currently in a stable condition, but there are fears there could be further deaths. Random community testing in COVID-19 hotspots is ramping up. Yesterday, just over 340 workers and shoppers were tested at a supermarket in Queenstown. Half of those tested have been processed and so far all have been negative. Today, similar testing is taking place at several supermarkets in Waikato and at one in Christchurch. Carolyn McElnay says this will give a snapshot of potential community transmission.
The reason that we chose supermarkets is because supermarket workers are in contact with a lot of people, so they would be highly exposed if there was something circulating in the community.
Carolyn McElnay says similar testing is expected in Auckland, but this is still being worked through. The New Zealand Nurses Organisation says it's unfair nurses are getting the blame for bringing COVID-19 into the workplace. The union says with recent cases at Waikato Hospital and aged care facilities, the employers were quick to put the responsibility on nurses and caregivers. Another nurse who was caring for coronavirus patients at Wellington Hospital was confirmed to have the virus today. A nurses' organisation spokesperson, Kerry Nuku, says the infection is more likely to have come from the workplace itself, and correct protective equipment is still an issue in some places.
PPE here, it is about making sure that we have full stocks available so that it is appropriate to the nurse that's putting that PPE gown on, or gloves on, or mask on, or visor on. It's important that it does fit them.
Kerry Nuku. 2 of the world's biggest drug companies are teaming up to try and find a vaccine for COVID-19 in record time and are pledging not to profit from it, at least in the short term. GSK and Sanofi are collaborating on a vaccine which is one of about 80 being developed. Christian Felter from Sanofi has told RNZ this is not the time for competition.
This is a time of collaboration. No one company is going to solve this by itself.
Dr. Christian Felter. Drug company GSK says it hopes to start human trials in the second half of this year and aims to have a vaccine available in the second half of 2021. New Zealand's stock market has finished the week on a high at levels not seen for weeks. The NZX Top 50 has just ended up 2.9% after gaining 4 days in a row. The market is sitting at levels not seen since early March, with the index back to levels seen in November. The rest of the Asia-Pacific markets are also more upbeat, taking a lead from Wall Street, which also finished up overnight. It's nearly 5:04. In sport this afternoon, the Sports Minister Grant Robertson says sport still won't be possible in New Zealand at Alert Level 3. With many recreational activities not allowed at Alert Level 4, sports competitions around the country have been suspended. The government will confirm on Monday if the country will move out of the level 4 lockdown, but Robertson says even if that happens, there won't be scope for sport to return.
At level 3, we want people to stay in their bubbles still, and so I know a number of our professional athletes are training hard inside their own bubble. When it comes to level 2, there is further work to do there as to what might be possible in terms of particularly contact sport at a professional level.
Meanwhile, Grant Robertson says plans to resume Rugby League's NRL competition late next month seem ambitious. The league wants to put all 16 NRL teams, including the Warriors, in a bubble and is consulting the Australian government about the New Zealand side arriving in Australia on May 3rd. But Robertson says he hasn't been involved in any discussions, adding strict quarantine rules on both sides of the Tasman create limitations. And that's the news. Coming up on Saturday morning, Kim Hill talks to international lawyer Philippe Sands, whose new book takes an intimate look at a leading Nazi and the mystery of his death. Author Anne Patchett on her latest novel, The Dutch House. And some tips from first-rate forager Joanna Knox for value-added lockdown walks. Join Kim Hill tomorrow morning after 8 here on RNZ National. Mid-service short forecast through to midnight tomorrow, Saturday now. Northland, Auckland, Coromandel and Bay of Plenty. Scattered showers turning to rain for a time tomorrow. Possible thunderstorms in Auckland. Waikato to Kapiti, including central high country. Showers turning to rain later. Some heavy falls and thunder as well. Rain easing tomorrow. Gisborne and Hawke's Bay, high cloud, patchy rain at times, becoming fine tomorrow afternoon. Wairarapa and Wellington. Cloudy periods today, rain for a time this evening, mainly fine tomorrow with a few showers in the morning. Nelson, Marlborough and Canterbury, partly cloudy with a few showers but mainly fine from tomorrow afternoon. Buller, Westland and Fiordland, periods of rain, some heavy and possibly thundery falls. Otago and Southland. Rain about eastern Otago, a few showers elsewhere, clearing tomorrow afternoon or evening. Chatham Islands, a few showers turning to rain late tomorrow. It's nearly 7 minutes past 5.
Thanks, Paul. Welcome to Checkpoint. I'm Lisa Owen. 2 more people have died from COVID-19 today. Both are connected to existing clusters, and that brings New Zealand's coronavirus death toll to 11. And in breaking news, as we go to air, Checkpoint understands up to 20 residents from the St Margaret's Hospital and Rest Home are being transferred to hospital. We've just had a statement handed to us. The Waitemata District Health Board says they are assisting with the temporary transfer of up to 20 residents from St Margaret's Hospital and Rest Home in Te Atatu. This is to help overcome staffing shortages. A number of St Margaret's staff have been stood down from work to go into precautionary self-isolation due to close contact with people confirmed positive for COVID-19. And this has impacted the facility's ability to maintain a full staff roster, they say. An agreement has been reached to transfer 6 St Margaret's residents to Waitakere Hospital this afternoon, and a further 13 patients will be transferred over the weekend if required by St Margaret's. The DHB says it will apply its compassionate visiting guidelines to allow the loved ones of residents to visit them where appropriate. And we will bring you more information on this as it comes to hand. But first tonight, some early childhood teachers fear their centres could become major breeding grounds for COVID-19 outbreaks if they're allowed to reopen after lockdown restrictions are loosened. The government says children up to year 10 should stay home if they can, when level 3 comes in. But there will be no checks to ensure only parents who cannot work from home are sending their children to class. Ruth Hill reports.
They drool, they put things in their mouths, they don't understand the first thing about social distancing. Preschoolers may be small, but they pose a huge risk when it comes to spreading viral disease. Huntly mother and early childhood teacher Hannah Swinkles says any one of the 230,000 children and staff in early childhood centres could end up triggering an outbreak of COVID-19. She started a petition calling for no schools or early childhood centres to open during Alert Level 3, which has already attracted more than 9,000 signatures. Mrs Swinkles says she's not willing to put her family at risk by going back to work.
All other physical contact in other businesses is prohibited, but it seems in education it's perfectly fine, so I feel like we're an exception to the rule.
Early Childhood New Zealand Te Rite Mahoa Chief Executive Kathy Wolfe says it would have been easier if the government had simply kept centres closed under Level 3, but she understands there's a need for parents to get back to work.
This now really puts a whole lot of grey into the black and white, and from being in lockdown. So it's abundantly clear that currently both the ministry and the sector will need to do a lot of planning and a lot of work in terms of making sure that services can open safely.
Kathy Wolfe says it's important to note that early childhood centres have no obligation to open under Level 3. But if they do choose to open, they could also choose to charge parents, even if those parents keep their children at home. It's up to the discretion of each centre. Darfield High School Principal James Morris, who chairs the Secondary Principals Council, says schools will need time to prepare.
The big unknown at the moment is how many students are likely to turn up, and parents at the moment may not even know that, depending on whether their business or their work will be able to continue or start up again in Level 3.
The president of the Principals Federation, Perry Rush, says at a briefing this morning, ministry officials gave school leaders a clear commitment to collaborate on the details, but the details themselves are still murky. He says one crucial detail to nail down is who will be allowed to return to school under Level 3.
I certainly do not think it'll be turn up if you feel like it on any given day. I think that is too difficult to resource in a school setting. So I think it will be important for schools and communities to understand that there will be needing to be a decision made about who attends and who isn't.
Finance Minister Grant Robertson says even if Level 4 is lifted next week, it will still be at least 2 weeks before schools can reopen. He trusts parents to make the right decision for their children.
Some parents will be in a position going back to work where they do need to make sure that their children go to school. Of course, if they can stay at home, and we want people to stay at home if they can, then they can be there with their children. So we've got time to work this through.
The Secretary for Education, Iona Holstead, says there's a lot of detail to work through, but public health and safety remains the top priority. For Checkpoint, Ruth Hill.
The Education Minister concedes a decision to partially reopen schools at Alert Level 3 is as much about childcare as education, and the preference is that students stay away. It follows a vocal backlash from teachers and principals who say the decision to partially reopen schools is irresponsible and will be a complete shambles. At Level 3, early childhood centres and schools would open up for students up to Year 10, but attendance will be voluntary. But if it's not safe to eat a burger inside a McDonald's restaurant at the same alert level, how is it safe to send even some of our children to school? I asked Education Minister Chris Hipkins a short time ago, is this education or childcare?
Well, of course, it's a combination of both. And we do have to realise that COVID-19 is likely to be with us for quite some time. And so we are going to have to find new ways of working in the meantime. I don't think it's feasible to leave schools and early childhood services indefinitely closed for all students. But it is going to be possible for us to move to new blended learning environments. We've got a lot of work to do in the next week to provide greater clarity around who will be coming into schools and under what conditions.
But you accept, Minister, sorry to interrupt, but you accept from what you were saying, a large chunk of this is a childcare decision.
Well, I think that you'll find that, parents rely on schools and early childhood services being open so that they can go to work. And we do need to be able to provide support for those families where people need to be able to go to work.
So how is it safe? Can you explain this to me? How is it safe for children to go back to school under Level 3 when it's not safe for me to eat a burger inside a McDonald's restaurant?
There are additional safeguards that we're going to have to put in place with schools and early learning services reopening. So there'll be much smaller group sizes, for example. There'll have to be additional protective measures put in place, additional cleaning that's put in place. I guess the difference with you going for a burger is that you might go to a multitude of different places all at the same time. We're wanting to keep people in consistent and stable patterns so that we know where they've been, we know who they've been associating with, and that includes children as well. So that if something does happen, then we can contact trace all of those people, and we can do that quickly. That's not the sort of thing that you can do if a restaurant or a bar is operating normally.
But if you've got early childhood, seriously, how are you going to keep those kids apart from each other, not playing rough and tumble with each other, not putting their grubby hands over their faces and over other people in the class, not sharing food? How are you going to socially distance early childhood?
The reality is you can't socially distance early childhood.
So how is it safe then?
Education. Well, there's a variety of things here. One, we can make the group sizes significantly smaller so that we're keeping the size of the bubble smaller, and that's one of the things that we'll be looking to do.
So fewer than 10, Minister?
We haven't actually set a specific number yet. We're working through the details of that at the moment, and we're looking at health advice. We're relying very heavily on public health advice here, and we're looking at what they've done in other countries overseas. It is really important to note, though, that the public health advice is telling us that the risk amongst children is very, very low, particularly amongst very low children, and there is very little evidence to suggest that young children get the virus, are affected by the virus, and pass that on to adults. And so we are looking, health. We're leaning very heavily on our public health officials here, so that because no one went through this for 4 weeks of lockdown at level 4, and potentially, we haven't yet made the decision to come out of level 4 yet. To see all that good work undone at level 3, the government's not going to be making decisions that put us at greater risk there.
But if public health advice is that it is unsafe to have any more than 10 people at a tangi or a funeral, or more than 10 people at a wedding, then are you going to have fewer than 10 children in every classroom?
Like I said, we haven't fixed a number on that yet. It's one of the things that we're working through with public health officials. And there are logistical issues that we've got to work through with the centres. For example, they've got to look, and it might be slightly different in different contexts, because you've got to look at the physical space that they have available to them, and making sure, we do want to make sure that we've got bubbles operating within an early childhood service, for example, that they can ensure they're not going to come into contact with another bubble.
Yeah, the Prime Minister, though, has told us very firmly that even if we go to level 3, we have to keep our bubble tight. Maybe just introduce 1 or 2 people. You're talking perhaps as many as 10 in that school setting, perhaps even more. Can you see how some people might think that you are sending a very mixed message here?
Well, no, because like I said, I think that the health advice is that the risks of COVID-19 spreading in, say, an early childhood setting are very, very low. And I think the way parents might find it useful to start thinking about it is that their children might have a home bubble and an early childhood bubble. And so we still want them sticking to within those bubbles and not coming into contact with people outside of those bubbles, so that we are still keeping everybody safe.
What do you say to the criticism that there is a lack of leadership at the top in education right now?
I think there's been some incredible leadership in education. I think the fact that we've managed to get everybody onto distance learning in a very short space of time suggests that people have been working incredibly hard to make this work. But we cannot keep schools and early learning services closed indefinitely. And we're working very hard to make sure that we're keeping risk very low, and that we're making decisions that are based on public health advice. Now, we've got some communication challenges around making sure that people are aware of how schools and early learning services will operate, that it won't be business as usual. They're not coming back. You won't see 600 kids in a school hall for an assembly for quite some time.
Okay, so how many kids are you expecting to come back? Are you asking parents to register if they'd like to send their kids?
Now, what we're saying is if parents can keep their kids home, we're asking them to keep their kids home. So they would have to...
So that's the point, Minister. You actually don't want them to turn up. In the statement on the Prime Minister's webpage, she says, for children who are able to distance learn, this is still the best option. So you actually don't want them to turn up, do you?
No, that's right. We need to have schools and early learning services operating for those who need to go to them. But we don't. If parents can keep their kids home, we are asking them to keep their kids home.
What do you think it's going to be like in practical terms for teachers to try and teach some children who are in the room and others who are still distance learning? How will that work?
Look, there's no doubt it's going to be a significant challenge, and we're supplying as much support as we can, including those hard packs of materials that are being put out there. There's a lot of resources that we're supplying to schools. There is no question this is going to be a real challenge for teachers, and I want to thank them for their professionalism in taking on the task. I think, like everybody else around the country, under the restrictive environment that we have under level 4 now, and under level 3 when we get to level 3, and even under level 2, everyone is having to work a bit differently, and everyone is going to be finding that quite challenging. And educators are no different in that regard to what the rest of the country is grappling with. This is a challenge for everybody.
So what guarantees can you give to teachers and parents that their children or they themselves will be safe in a school environment when they have to come back under level 3, teachers in particular?
Yeah, look, the guarantee that I can give them is that we're relying on public health advice when we make these decisions around the reopening of schools and early childhood services. I can also give them the guarantee that we are not going to take action if it risks putting the gains that we've made during the level 4 lockdown, if it risks us undoing that good work. So we're working very, very carefully through that and considering all of those criteria in great detail. And I also do want to provide the reassurance that even when we get to the point where schools and early learning services are operating, people who are in higher risk categories, and we've got a number of teachers who are older and in higher risk categories, we will be supporting them to stay home.
Would it be best if parents did register if they wish to or plan to send their children to school? Because we know some parents are being emailed by schools asking for them to register. So what's your position on that?
That's one of the things that the Ministry of Education has been working through with schools today, and they'll keep working through that over the next day or two. So I think by early next week, we'll have much clearer guidance to be able to give to schools and to parents. Bearing in mind, we're still several weeks away from when schools and early learning services are likely to reopen. And I think in preparing that more detailed guidance, it is important that we work with the people who are ultimately going to have to implement it.
Minister, just before you go, should private schools be collecting wage subsidies when they're getting fees from parents?
Look, it's going to differ based on the scenario they find themselves in. They still need to meet the same criteria as other businesses who are collecting the wage subsidy, which means they have to demonstrate that their revenue has decreased by more than 30% directly as a result of COVID-19. And if they meet that criteria, then they can collect the wage subsidies.
So you're comfortable with private schools collecting wage subsidies?
Oh, look, I'm comfortable with any organisation that finds that its revenue has declined by 30% because of COVID-19, collecting the wage subsidy, because that's what it's there for.
Thank you, Minister. Really appreciate you joining us. Could you get your children to draw something so we can put it on the wall behind you so you look like you're not in home detention?
It does feel a bit like home detention at the moment, I can tell you.
We need some artwork there for next time. Thank you. Have a good weekend.
All right, you too. Thanks.
Bye-bye.
Bye-bye.
And that was the Education Minister, Chris Hipkins, talking to us via Skype there. It is 22 minutes past 5 and you're with Checkpoint on RNZ National. Keen for your feedback on that. Are you happy to send your children back to school under Alert Level 3 or not, and why? You can get in touch via text 2101. You can tweet us at Checkpoint RNZ or send us an email, checkpoint@rnz.co.nz. Meanwhile, New Zealand has reported its lowest daily number of new COVID-19 cases since it went into lockdown, with the total climbing by just 8. It brings the national total to 1,409, of which nearly 60% have recovered. The encouraging development, though, comes with more sobering news. The death toll has climbed by 2 to reach 11. Here's our Deputy Political Editor, Craig McCulloch.
When ministers on Monday mull whether to lift the lockdown, it's the latest data they'll look at. And today's numbers would seem a positive sign.
Today, New Zealand's total number of COVID-19 cases has increased by 8.
8 new cases, a low not seen in nearly a month, and every one traced back to another case or a known outbreak. But don't celebrate just yet.
This is a long game, a marathon, not a short sprint.
The Finance Minister, Grant Robertson, says Cabinet will wait right up until Monday before it makes its call, weighing the most up-to-date numbers, as well as the country's ability to rapidly trace the contacts of any new cases.
There is still more work for us to do to decide on that.
And the stakes could barely be higher. Another 2 deaths were reported today, a sobering reminder of that. One man in his 90s at Waikato Hospital and a woman in her 80s from the Rosewood Rest Home in Burwood. The Director of Public Health, Dr Carolyn McElnay, confirmed both died without their families alongside them.
These people and their families will be in the thoughts and prayers of all New Zealanders today, as we are again reminded of the serious threat that COVID-19 poses.
Before relaxing restrictions, ministers will want to be certain the virus is not spreading undetected. Roughly 40 of the 1,400 cases around the country have been deemed a mystery, with another 40 or so still being investigated. To boost confidence, random testing is being rolled out at hotspots around the country. About 350 people were swabbed at a supermarket in Queenstown yesterday. The same is happening in 5 Waikato towns today and in Christchurch too.
Well, I had a sore throat in the last week or so, and I had a lot of health issues in the past. I heard over the news it was on today, and I thought today was my big chance to get a test.
I work with the public, so it's actually quite nice to find out whether you definitely do or don't.
The ministry is planning more of the same in future, including in Auckland.
So it won't be perfect information, but it gives us a snapshot of people in the community.
And that snapshot will be critical for the government's understanding of the outbreak. The Prime Minister outlined the basics of Level 3 yesterday, a sort of lockdown light. Today we learnt some more details. Professional sports are a no-go. Hunting may be okay, but officials have yet to make a final call. And all schools will have a week from the start of Level 3 to prepare before reopening. For the most part, it's only a slight relaxation of the rules. The biggest difference will be the return of some to work. But even a slight relaxation brings with it risk. And Mr Robertson says Kiwis must continue to stick to the Level 4 rules for now.
Going hard and going early has put us in a good position. Things could have been very, very different. So let's not waste this chance.
A chance few other countries have. Another reason why Monday's lockdown decision is so crucial. From Parliament for Checkpoint, Craig McCulloch.
And in more breaking news, the Southern District Health Board says it has identified one more case of COVID-19 following its random testing of 340 people at a pop-up centre at Pack and Save in Queenstown yesterday. The DHB has received around 2/3 of the results back, and all but one have been negative so far. It says it expects to get the remaining results tomorrow. And as you heard me discuss with Minister Hipkins a few minutes ago, several private schools are among the tens of thousands of businesses receiving the government's wage subsidy, with the total bill now nearing $10 billion. More than 85,000 businesses have been processed and uploaded to the government's searchable database. They also include the country's largest law firms. The government says the scheme is working and is keeping people in work. But the Ministry for Social Development has also begun auditing companies receiving the subsidy to check that they do in fact meet the criteria. Nita Blake-Person reports.
1.6 million employees from businesses across the board are now getting $585 per week in wage subsidies. Finance Minister Grant Robertson says the scheme is working.
The wage subsidy is doing its job to protect jobs and help businesses and workers stay connected through the lockdown. To date, the subsidy has paid out $9.9 billion since we announced it on March 17th and is protecting the jobs and incomes of 1.6 million workers. In comparison, there are roughly 23,000 new people on job seeker support over that time. That represents about 1.5% of the amount of workers being covered by the wage subsidy.
Businesses receiving the subsidy are searchable using a database on the Ministry for Social Development's website. Only 5 results are displayed at a time, but a quick fishing expedition reveals virtually no part of the economy has been untouched. Air New Zealand has claimed more than $70 million, the Warehouse nearly $52 million, Briscoe's $6.4 million. The retirement village company Somerset has received $8.8 million. 3 of the country's largest law firms are also getting the payment. Bell Gully's getting $1.8 million, Minter Allison $2 million and Simpson Grierson on $2.3 million. Business commentator Phil O'Reilly says the wage subsidy is the most important thing the government has done to support business.
What you see as a result of the bulk of the spending is just how massive the impact of this has been on the economy. You've got, hundreds of thousands of workers being supported by this wage subsidy, and otherwise they'd be potentially sitting on the dole queue right now. So the scale of the spending is really no more than an indication of the scale of the terrible economic impact that this thing has had on businesses and on staff members and on communities over the last several weeks and will have for some time yet.
Even private schools are feeling the pinch. Scots College in Wellington has received $1.1 million. Chiltern St James gets nearly $400,000. Iona College in Havelock North $300,000. Ficino School in Auckland around $250,000, and St Bede's in Christchurch $130,000. Destiny Church is also getting a payout. Several of its branches, as well as its school, are receiving subsidies. The Ministry for Social Development said wage subsidies were not available to state sector organisations, but if an independent school or preschool meets the eligibility criteria, they can apply for the wage subsidy. Businesses are still being uploaded to MSD's website, but it's now double-checking those who receive the money. MSD wouldn't be interviewed for the story, but in a statement said,
"During the initial phase of processing the wage subsidy applications, our focus was on getting subsidies to thousands of employers as quickly and as efficiently as possible. This process included information matching with Inland Revenue. We are now retrospectively auditing samples of those who have applied and been paid the subsidy to help ensure payments are only made in legitimate cases. Businesses who genuinely applied in error and subsequently refund all of the subsidy will have their name removed from the database once the refund is received."
To put the scheme's cost in context, the $9.9 billion bill so far is more than 10% of the total core Crown revenue for the 2018-19 financial year. Susan St John is an Associate Professor of Economics at the Auckland School of Business. She says the policy was totally necessary as the brakes went on the economy, but she fears for its future.
Wage subsidy was important in the first instance to keep employers tied in and associated with employment with their employer. But if that all comes to an end, then we really do have to think very seriously about the inadequacies of what people will be left with.
Susan St John says she wants to see the wage subsidy scheme become integrated into a new and modernised welfare system to meet the realities of permanent job losses and redeployment following COVID-19. For Checkpoint, Nita Blakeperson.
Coming up on Checkpoint on RNZ National, two of the world's biggest drug companies team up to try and find a vaccine for COVID-19. How much has your life changed since February 28th? We take a look back at New Zealand's first 50 days living with COVID-19. And an Auckland dad's Kiwi ingenuity to keep his 10-year-old daughter connected to her two best friends, who happen to live right next door. The social distancing seesaw. You've got to see this to believe it. We would love your feedback, especially on the return to school. Will you be sending your children back? You can text us on 2101 and you can tweet us at Checkpoint RNZ, Facebook us Checkpoint, or email checkpoint@rnz.co.nz. But let's get to the headlines now with Paul Brennan.
Thanks, Lisa. Up to 20 residents from the St Margaret's Hospital and Rest Home in Te Atatu are being transferred to Waitakere Hospital due to staffing shortages. The Waitemata District Health Board says some rest home staff are in self-isolation. It says 6 residents are to be transferred this afternoon and another 14 may be moved over the weekend. Cabinet Minister Grant Robertson says schools won't open for at least a week after any move to level 3, and there is still time to iron out the kinks. Early childhood centres and schools up to Year 10 will open their doors, but the government is encouraging parents to keep children at home if they can. Principals are warning the partial reopening could be a shambles, and maintaining social distancing would be very challenging. The Education Minister concedes a decision to partially reopen schools after a move to Alert Level 3 is as much about childcare as education, and the preference is that students stay away. The Principals Federation President Perry Rush says schools now have to know which students are returning so they can plan, and need certainty to ensure bubbles within schools are safe. A nurses' union says it's investigating after a Wellington nurse was diagnosed with COVID-19. The Capital and Coast DHB says the nurse was using full PPE while caring for coronavirus patients and hasn't worked for the past 10 days. The nurses' organisation says it's unfair to blame nurses for bringing COVID-19 into hospitals, and the infection is more likely to have come from the workplace itself. More random community testing is being done in COVID-19 hotspots following yesterday's testing at a Queenstown supermarket. Testing has been taking place at supermarkets in Waikato and at one in Christchurch, with the aim of getting a snapshot of potential community transmission. And New Zealand's stock market has finished the week on a high at levels not seen for weeks. The NZX Top 50 Index has ended up 2.9% after gaining 4 days in a row. And those are the headlines.
Thanks, Paul, and welcome back to Checkpoint. I'm Lisa Owen. Let's get to the business news with Nona Peltier. Hi, Nona. The Warehouse, well, it's another company that says it's going to have to cut salaries and wages. So what exactly is it proposing?
Yeah, we're talking about a 20% pay cut. This is a proposal, of course. Everything has to be done by negotiation. But we're talking about a 20% pay cut for sort of the directors, executive team, and people who earn more than $100,000 a year. If you earn between 60 and 100, you're looking at a 10% pay cut. And if you're earning less than 60, no pay cut at all. So the government's given the Warehouse a wage subsidy of some $67 million, which should see it through. They're going to review the situation again in June, and or when the we get to a level 2 lockdown, in which case, and they should be able to open 285 stores closed.
Do we know anything about the number of workers they employ, Nona, or how many people fall into those categories?
Just over 11,000 workers. I don't know what percentage of them are earning less, but I suppose that information would be public because they received a wage subsidy for those people. Yeah.
Okay, so job seekers, well, they're being told to, do more than just freshen up their CVs. So what's the advice there? Because there'll be a lot of people on the market.
Yeah, so yesterday we talked about the numbers that we got from Seek, and we said that the number of job ads was down 30%, but we now know that in the last week of March, the number was down 76%. And so the Seek folks say, look, there's lots of information on their website if you want to go and have a look. But what they're recommending is that when people go to look for a new job, to not think about what they used to do, because those jobs might not be there anymore, and to focus more on their skills, thinking about how their skills could be applied to new jobs, different jobs. That's what people have to do, open their mind, because, if you're a cabin crew, for example, at Air New Zealand, you're not going to get your job back if you get made redundant. And we have heard about pilots stocking shelves in the supermarkets.
Okay, so what else has been going on the markets today?
Yeah, big day on the market. We were up above 3% for some time this afternoon. And just at the end, I guess there was some profit takers in there because we dropped back to about 2.9%, which is still a very strong increase. We're talking, 306 points up to 10,779. Now, we haven't seen those levels since November when we were moving up towards, there were some strong growth there in the markets. And back to early March.
Oh, we're just losing you there, Nona.
Because we got some really...
I think we...
Okay.
You're fading in and out. You're fading in and out, Nona. So just before you go, maybe you could just give us have a crack at giving us the dollar. Well, let's see if the line holds up.
2 US cents, 94.5 Australian, and 48.2 British pence. And that increase there, 60.2 US cents, is a lot better than where we were yesterday.
Well, we got at least two of them. Thanks, Nona. That's Nona Peltier with the business news, joining us by, a slightly patchy Skype line there. Think Big Pharma, and you normally think fierce competition and big profits. Now, two of the world's biggest drug companies are teaming up to try and find a vaccine for COVID-19 in record time. And they're pledging not to profit from it, at least in the short term. GSK and Sanofi are collaborating on a vaccine, one of about 80 being developed. 7 of those are already in early stage human clinical trials, squeezing years of research into just months. Here's Guy on Espiner.
Normally, it's among the most competitive of industries, but these are not normal times.
This is not a time of competition. This is a time of collaboration.
That's Dr. Christian Felter, head of medical with the giant drug company Sanofi.
No one company is going to solve this by itself. So we all need to be working forward, taking advantages of the scientific platforms that we have to try to bring forward a vaccine that is safe and effective and ready to be given as soon as possible.
Sanofi has teamed up with another behemoth of Big Pharma, GSK. They are moving together and moving at speed. Michael Nissen, the Director of Scientific Affairs and Public Health at GSK, says they're hoping to achieve in 12 to 18 months what might usually take 10 years.
The expectation or hope is that human trials will start in the second half of this year and then hopefully have a vaccine, if it's successful, for the population in the world in the second half of 2021.
But this is not a done deal. Dr. Graham Jarvis, Chief Executive of Medicines New Zealand, which represents the big pharmaceutical companies here, says just 6% of potential vaccines actually reach a global vaccination program.
Like any development of any drug, there's a high risk and a high failure rate. And so it's reassuring, and I think we can all be reassured that if we've got well over 80 candidates that are working their way through the development program, that we'll see one, and I think more than one vaccine will be developed successfully for COVID-19.
But first, researchers have a fiendishly complex puzzle to solve. Dr. Felter of Sanofi explains that scientists start looking for sugars or proteins on the surface of the virus.
It takes a long time before you figure out which of the dozens and hundreds of proteins is the right one. And then once you figure that out, you have to figure out how to make it, how to be able to formulate it in such a way that you can inject it into somebody and that they will develop a protective immune response.
The good news is we have a head start from our knowledge of other viruses. Dr. Felter says the influenza vaccine is a good base to work from. It has to be regularly reviewed to combat the flu virus, which is constantly changing.
So the platform that we're using is made to be changed. And so instead of putting in this year's influenza strain, we're actually putting in proteins from COVID-19.
They are also applying their knowledge from SARS, which is also a coronavirus, to see which proteins would need to be a component of a vaccine.
So taking those two pieces together, we've been able to give ourselves a massive head start.
But past experience has also highlighted dangers. Dr. Nissen from GSK says research on SARS showed there are potential risks involved in developing these vaccines.
It may lead to an increased immune response, so that's why safety will remain a critical and important part and piece of the puzzle in having a successful vaccine in the future.
If they can figure that out, then the challenge becomes making enough of the vaccine to meet global demand. Dr. Felter said Sanofi is gearing up manufacturing capacity to produce hundreds of millions of doses.
Getting a product approved and getting through those trials is just the first challenge. The next challenge is producing it in sufficient volumes so that we can make sure that everybody who needs it, which is virtually everybody, can get one.
With a customer base of potentially 7 billion people, you'd think it would be a lucrative product. Well, apparently not. Graham Jarvis says that both GSK and Sanofi have said they will not make money from the vaccine, at least in the short term.
The cost of the vaccine for the world's population is going to be at a not-for-profit. They're not going to be making any profit from these vaccines when they come out during the pandemic.
Dr. Nissen of GSK says it's a once-in-a-century challenge.
These challenges, yes, they are devastating, but they also stimulate real progress sometimes in medical and health innovation.
Progress we're all hoping for if our lives are going to return to anything like normal. For Checkpoint, ko Gaian Espinatine.
It's 18 minutes to 6. I'm Lisa Owen and you're with Checkpoint on RNZ National. We're keen for your feedback. You can text us on 2101. You can tweet us at Checkpoint RNZ or email checkpoint@rnz. Now remember, Cabinet is deciding on Monday whether we come out of lockdown or not. So if you had a vote, what would it be and why? We'd love to hear from you. How much has our life changed in 50 days? That's how long New Zealand has been living with COVID-19. Since our first confirmed case at the end of February, we've seen a rush on supermarkets, the stockpiling of hand sanitizer, Dettol and toilet paper. Our borders closed, airlines have stopped carrying passengers, and an unprecedented economic bailout package was launched, and a 4-week nationwide lockdown. Today, we have 1,409 confirmed COVID-19 cases and 11 deaths. And we've learned to live life the best we can in our bubbles. Lydia Batham takes a look.
It was always a case of when, not if, and on the 28th of February, COVID-19 reached New Zealand.
The Ministry of Health has tonight confirmed New Zealand has its first case of coronavirus.
4 days later came the second case.
The second case of COVID-19 is confirmed in a New Zealand citizen. This is a woman in her 30s, recently returned to Auckland from northern Italy.
By the 7th of March, New Zealand had 5 confirmed cases. Life remained much the same, except we were starting to see the first run on toilet paper. Here's Craig Irwin from market research company IRI.
Toilet paper, water, even dietary supplements. And some of those categories are up 20, even 50%. This, at the moment, is the 5th biggest week of the year, and the only other weeks that beat it are the 4 weeks around Christmas.
Then, on Friday the 13th of March, events began being postponed.
This morning, the plug was pulled on this weekend's Pacifica Festival due to host tens of thousands of people. And the Corona Piha Pro Surf event, featuring world champion Kelly Slater, has been postponed indefinitely. Concerts further along the calendar, including My Chemical Romance and Deftones, have also been postponed.
The following day, the first anniversary event for the Christchurch mosque attack was cancelled, and Prime Minister Jacinda Ardern brought in some of the strictest border rules in the world.
As of midnight Sunday, every person entering New Zealand, including returning New Zealand citizens and residents, will be required to enter self-isolation for 14 days. Everybody. The Pacific are exempted from this measure. They are the only ones. Anyone from this country, though, will be required to automatically self-isolate should they exhibit any COVID-19 symptoms upon arrival in New Zealand.
This was March 14th, and at this point, 8 people had COVID-19 in New Zealand. The next move on Monday the 16th of March was a ban on gatherings and events of more than 1,000 people. RNZ's Deputy Political Editor Craig McCulloch explained what that meant.
All major events, indoors and outdoors, this applies to festivals, fairs, sporting events. The Prime Minister talked about religious and cultural events as well.
While the virus had only been in New Zealand a few weeks, the economic impact had been felt for a while. And on Tuesday, the 17th of March, the government announced a huge economic stimulus package.
The government has today administered the economy an unprecedented $12.1 billion shot to help those hit hard by the COVID-19 epidemic. In what it calls the largest peacetime economic plan in New Zealand's modern history, the package is more than all of this government's new operating spending across 3 budgets combined.
It's included wage subsidies of $5.1 billion, $125 million for a self-isolation support fund and $500 million for health. That day, the 17th of March, the number of confirmed cases here in New Zealand was 11. This was the day a group of people gathered at Matamata's Redoubt Bar to celebrate St Patrick's Day, and later became one of the country's biggest COVID-19 clusters. The following day, the number of confirmed cases jumped by 9 to 20. At this point, all were linked to overseas travel or confirmed cases. On Thursday, the 19th of March, things ramped up again. First, Health Minister David Clark announced tighter restrictions on gatherings.
Today I can confirm we are extending that advice to indoor events of 100 people or more.
Later that day, the Prime Minister, amid reports of tourists flouting the 14-day self-isolation rules, made an unprecedented move.
From 11:59 p.m. tonight, we will close our border to any non-residents and citizens attempting to travel here. This will stop tourists or temporary visa holders, including students or temporary workers, from coming to and entering into New Zealand. New Zealand citizens and permanent residents will be able to return. And of course, that includes the children and partners of citizens and permanent residents. These changes will also apply to the Pacific.
Then, on Saturday, the 21st of March, the Director General of Health, Ashley Bloomfield, confirmed they'd been unable to trace where 2 people caught the virus. And Prime Minister Jacinda Ardern made an unprecedented lunchtime public address from the Beehive to the nation.
There are 4 levels to the alert system. At each level, there are things we need you to do to keep you safe. And there are things the government will do too. Alert level 1 is where COVID-19 is here but contained. In this phase, we prepare. The basics like border measures, contact tracing, and cancelling mass gatherings are all activated. You will see that this is where we have been when COVID first arrived in New Zealand. Alert level 2 is where the disease is contained, but the risks are growing because we have more cases. This is when we move to reduce our contact with one another. We increase our border measures and we cancel events. This is also the level where we ask people to work differently if they can and cancel unnecessary travel. Alert level 3 is where the disease is increasingly difficult to contain. This is where we restrict our contact by stepping things up again. We close public venues and ask non-essential businesses to close. And alert level 4. This is where we have sustained transmission. This is where we eliminate contact with each other altogether. We keep essential services going, but we ask everyone to stay at home until COVID-19 is back under control.
She introduced a 4-level alert system for COVID-19, with New Zealand placed at level 2. Almost immediately, a petition was launched to raise us to alert level 4, meaning a lockdown. And just 2 days later, on Monday the 23rd of March, the Prime Minister responded.
Effective immediately, we will move to alert level 3 nationwide. After 48 hours, the time required to ensure essential services are in place, we will move to level 4. These decisions will place the most significant restrictions on New Zealanders' movements in modern history. This is not a decision taken lightly.
There was immediate panic at the shops.
It is really insane. Quite a few people starting to lose their rag a wee bit, to be honest.
Oh, it's chaos, absolute chaos.
The day before we entered the 4-week lockdown, a state of emergency was declared. At about 6:30 p.m. on Wednesday the 25th of March, phones across the country buzzed with an emergency alert, reminding us all of the new rules. There was no countdown clock or event to mark this momentous occasion. The nation just quietly went into lockdown as we entered the 26th of March. As RNZ's Joe Moyer reported, on that first day, we did well.
The Police Commissioner says overall, New Zealanders have been very responsive to the call to stay home. And as far as he's aware, there were no major problems or arrests after the midnight deadline.
And thanks to Christchurch woman Deb Hoffman, we found new ways to entertain children.
You place a soft toy, a teddy bear, a rainbow, anything in front of your window that's visible from the street. And people can then look on their streets and see who's taking part.
Then, a month and a day after the first case here, and on the 3rd day of lockdown, the news no one wanted to hear.
Sadly, New Zealand has had its first death linked to COVID-19 on the West Coast early this morning.
By the 1st of April, there were 708 cases of COVID-19 in New Zealand. And as people stayed home in their bubbles and washed their hands, it didn't stop Health Minister David Clark breaking the rules. He was forced to apologise after he was spotted by a member of the public at a mountain biking track. 4 days later, he was in trouble again.
The Health Minister, David Clark, will keep his job for now after breaching the lockdown rules. But the Prime Minister says if it had been any other time, he would have been sacked. Dr Clark has admitted acting like an idiot, saying he let the team down after driving his family 20 kilometres to a beach for a walk on the first weekend of the lockdown. He'd already apologised for driving a few kilometres in his branded electric van to a mountain bike track in Dunedin.
In amongst all this, the Prime Minister found time to allay children's fears ahead of the Easter weekend.
You'll be pleased to know that we do consider both the Tooth Fairy and the Easter Bunny to be essential workers.
In the week leading up to Easter, there was cautious optimism as each day saw a lower number of new cases. But then, on Good Friday, an unexpected press conference.
My name's Caroline McElnay and I'm Director of Public Health at the Ministry of Health. The Ministry of Health is sad to report the country's second death linked to COVID-19.
It wasn't the only death over Easter weekend. By Tuesday the 14th of April, the death toll had climbed even further.
Today I'm very, very sad to report 4 additional deaths linked to COVID-19 infection. One of those was in Wellington and 3 are additional deaths from the Rosewood cluster in Christchurch. This brings the total number of deaths in New Zealand to 9.
But there was also a glimmer of hope. With less than a week left in the initial lockdown period, we learned what life might be like at level 3.
Level 3 is lockdown light. Kiwis are still asked to stay at home as much as possible, not to travel outside their region, and to limit their contact with others.
Today marks 50 days since the first case. Since then, there's been 1,409 cases, 816 recoveries, and 11 deaths. 50 days ago, few could have imagined where we are now. Those 50 days have seen our lives dramatically changed, and as the Prime Minister said, this is a marathon, not a sprint. Her message stays the same.
Stay at home. It will break the chain of transmission and it will save lives.
For Checkpoint, Lydia Batham.
And that was Lydia Batham there. Seems way more than 50 days, doesn't it? Well, with schools closed until the country moves from alert level 4 to level 3, many kids around New Zealand have been missing their friends. But one West Auckland father has used his Kiwi ingenuity to keep his 10-year-old daughter connected to her 2 best friends who happen to live right next door. Indira Stewart and video editor Simon Rogers explain.
Summer, Frida and Lily are all 10 years old and the best of friends. Normally, they'd be in each other's backyards playing whenever possible, but the level 4 lockdown has cancelled playdates for kids across the country. So West Auckland father Lauren McIver and his partner Stephanie Livingstone found a way to get around that.
Laying in bed watching Facebook and seeing something pop up and thought, oh, look at this one. She said, Steph said, oh, that's our mission for today.
That mission was to build a seesaw through their fence.
And I pretty much nagged him until it was done.
Just 2 days into lockdown and after getting the neighbours' permission, Lauren cut a hole through his fence and there was no going back. He put a plank right through it and built a seesaw so that Summer and Lily, who lives next door, could still play with each other. The plank sits at about 1 metre off the ground and is almost 4 metres long. Around 2 metres stick out on either side of the fence. That's more than the distance required for COVID-19 physical distancing safety measures. It's got 2 heart-shaped seats cut out by Lauren for the girls to sit on, meaning they can still play together while staying in their bubbles. Summer says her best friend Lily was over the moon.
She thought it was pretty cool. She thought she was quite lucky to be that side. Whenever we see each other, she's always like, "Gonna go on the seesaw?" I'm like, "Yeah." And then we always do it. Rule: no TikTok dancing on the seesaw.
Lauren's next mission is figuring out what he can build to connect Lily, who's on the other side, to both Summer and Frida.
Lily was sad that she didn't get one on her side at first, but then when I said, "Don't worry, when it's all over, we can all go on the seesaw together."
In the meantime, the girls have figured out some great ways to keep their friendships alive. They learn TikTok dances by the fence, use joey guns to shoot flower buds at a target in the driveway, and Lauren even put a camp-style fire in a large can in between the fences so the girls could toast marshmallows together at a safe distance while staying in their bubbles. Stephanie says of all Lauren's ideas during lockdown, the seesaw has been pretty special.
I don't think we quite realised how special it was until we started showing like our family and stuff on video calls. And then they were just like, "Oh my gosh, that is so cool. You should put that on Facebook." And then after probably about the 10th person said that, I was like, "I should put this on Facebook." And then, just the way that the community page and everyone's comments, I was like, wow, okay, this is actually, we're pretty lucky. Hashtag best dad ever. Just everyone is so supportive and loves it so much.
And when the lockdown's over and the country eventually moves to level 2, what will happen to the seesaw?
What do you think, son?
Keeping it.
Keeping it? Dad?
Make it bigger and better.
Oh, bigger and better.
For now, 10-year-old Summer says she's pretty grateful for her dad's Kiwi ingenuity, which has helped her stay connected to her best friends next door, even during lockdown.
Amazing. Creative.
For Checkpoint, Indira Stewart. Summer, Frida and...
That was absolutely amazing. Now, if you were listening to that and you want to see the 4-metre long seesaw, the story is on our Checkpoint Facebook page. And I think the rule about no TikTok dancing on it is probably a really good idea. Some of your feedback before we get to the news at 6. This is on our interview with Chris Hipkins. This person says the Minister is naive. As a chair of the board with 50 years in education, I spent 2 hours with our principal discussing how our shifts will take place. Too many unknowns. We will get through in our own way and the silly MOE edicts will follow. Surely you do not make statements unless some detail is worked out. I could say so much more, but you wouldn't be able to read it out. Another person says, my husband and I are working full-time, mostly from home. It's very difficult to educate 3 children at 3 levels. We are in a region where there has been no community transmission. Logic says school is safe in this environment and a better place for education, but guilt and fear says keep them at home. I think the guidance is a little unfair. Another person says lockdown level 3, it is all test and adjust, test and adjust. This is how high performance companies and special forces work. The government has to test and adjust and make fast decisions. But this person says, I have a 2-year-old and will not be sending him back to ECE in Alert Level 3. My husband and I can both work from home, but even if we couldn't, I would find a way not to send him. As an expert who was in RNZ a couple of days ago said, it's probably the highest risk place for COVID-19 spread and simply isn't worth it for anyone. The decision this government has made so far is the only one that this person has been disappointed with. And another person says that they wouldn't do it either.
RNZ News at 6. Kia ora, good evening, I'm Paul Brennan. The Education Minister admits the reopening of schools is for both education and childcare purposes. There are mixed views about schools reopening if the alert level is lowered next week. One principal predicts it will be a shambles and questions whether children will be going back because parents are sick of them. But the Minister, Chris Hipkins, has told Checkpoint that COVID-19 is likely to be with us for quite some time, so we will have to find new ways of working.
I don't think it's feasible to leave schools and early childhood services indefinitely closed for all students, but it is going to be possible for us to move to new blended learning environments. We've got a lot of work to do in the next week to provide greater clarity around who will be coming into schools and under what conditions.
Chris Hipkins says there must be support for families where parents need to go to work. A petition calling for schools and early childhood centres to stay closed during Alert Level 3 has already had nearly 12,000 signatures. Huntley mother and early childhood teacher Hannah Swinkles, who launched the petition, says any one of the 230,000 children and staff in the country's early childhood centres can trigger an outbreak. She says children can spread infection through a centre very easily, and if she goes back to work with her son, they are doubling their exposure. Mrs. Swinkles says she's not willing to put her family at risk by going back to school. Residents from a West Auckland rest home are being transferred to hospital this evening due to staff shortages. The Waitemata District Health Board says several staff from the St Margaret's Hospital and Rest Home in Te Atatu are in self-isolation after close contact with people confirmed to have COVID-19. It says the facility is now struggling to maintain a full staff roster. 6 St Margaret's residents are being taken to Waitakere Hospital and up to 14 more will be transferred over the weekend if required. The government says the low number of new COVID-19 cases is a sign that Alert Level 4 is working, but warns we should not get ahead of ourselves. There were just 8 new cases today, despite 4,241 tests being carried out yesterday. The Cabinet will decide on Monday whether the country is ready to move to Alert Level 3. Cabinet Minister Grant Robertson says while the numbers are encouraging, there is still a lot to consider.
We still have more data to collect, and we still have to take what is a critical decision very, very seriously. As I outlined, a number of other countries have taken the decision to extend their lockdown periods. We'll make ours on the basis of the most up-to-date data that we can get.
Grant Robertson says the Cabinet must also be satisfied that testing and contact tracing is robust. The total of infections in New Zealand is now 1,409, while the death toll has reached 11 after the death of 2 elderly people in Christchurch and Waikato yesterday. Random COVID-19 testing in Queenstown has so far failed to find any cases of COVID-19. More than 340 volunteers were swabbed in a Frankton car park yesterday, and about half the results have been processed. More random testing is underway in Christchurch and Waikato today to work out how far the virus has spread in the community. and help the government decide when to ease lockdown restrictions. Southern Medical Officer of Health Susan Jack says the initial results from Queenstown are in line with expectations. None there has developed symptoms of COVID-19 since about the 9th of April.
That's just over a week ago. So the numbers of cases in Queenstown have dropped off, and so we're very pleased that none of these other tests have come back positive.
Dr. Susan Jack. The French president says China is covering up aspects of the coronavirus outbreak. World leaders are gradually becoming more critical of the Chinese government. Here's our foreign news reporter, Max Toll.
Emmanuel Macron says he believes China has not been fully forthcoming, and it would be naive to say the country has handled the crisis well. Earlier today, the acting UK Prime Minister, Dominic Raab, said hard questions would have to be asked about how the pandemic started and whether it could have been stopped earlier. Their comments echo China's leading critic, the US President Donald Trump, who says China lied about the risks of an outbreak and is disguising its real death toll. A short time ago, officials in Wuhan revised up the number of deaths in the city by more than 50%. The municipal headquarters in Wuhan insists there's been no cover-up. This is Max Toll.
It's 6:04. In sport this evening, the Sports Minister Grant Robertson says plans to resume Rugby League's NRL competition late next month seem ambitious. The NRL wants to put all 16 teams, including the Warriors, in a bubble and is consulting the Australian government about the New Zealand side arriving in Australia on May 3rd. But Mr Robertson says he hasn't been involved in any discussions, adding strict quarantine rules in both countries create limitations. Meanwhile, he says sport still won't be possible in New Zealand at alert level 3. The government will confirm on Monday if the country will move out of the level 4 lockdown. But Grant Robertson says even if that happens, there won't be scope for sport to return. He says there's further work to do with what will be possible for sport at alert level 2. And that's the news.
This is a COVID-19 official government announcement. While New Zealand remains at alert level 4, the government has released more information on alert level 3. This information is now available on covid19.govt.nz. Remember, we need to continue to stay home to save lives and break the chain of transmission. Don't travel, don't visit others, and don't do anything that could put you in danger and needing rescue. If you have flu-like symptoms, please get tested. Contact your GP or healthline. If you're struggling to get food, medicines or need transport to get essential goods, your local Civil Defence Emergency Management Group may be able to help. Go to covid19.govt.nz for more information.
Short forecast now through to midnight tomorrow, Saturday. Northland, Auckland, Coromandel and Bay of Plenty. Scattered showers turning to rain for a time tomorrow. Possible thunderstorms in Auckland. Waikato to Kapiti, including central high country. Showers turning to rain later today. Some heavy and thundery falls. Rain easing tomorrow. Gisborne and Hawke's Bay, high cloud. Patchy rain at times. Becoming fine tomorrow afternoon. Wairarapa and Wellington, cloudy periods today. Rain for a time this evening. Mainly fine tomorrow. A few showers in the morning. Nelson, Marlborough and Canterbury, partly cloudy with a few showers but mainly fine from tomorrow afternoon. Buller, Westland and Fiordland, periods of rain, some heavy and possibly thundery falls. Otago and Southland, rain about eastern Otago, a few showers elsewhere, clearing tomorrow afternoon or evening. Chatham Islands, a few showers, turning to rain late tomorrow. It's 6:07.
Thanks, Paul. And if you're just joining us, this is Checkpoint and I'm Lisa Owen. At least 400 people lined up outside a Christchurch supermarket today to get tested for COVID-19, part of a targeted network of testing stations set up in New Zealand. In addition to Christchurch, the Ministry of Health has so far set up stations in 5 Waikato locations and 1 in Queenstown. Many of those who lined up say while it was a long wait and a rather uncomfortable swab up the nose, it was all worth it for their health. Our Christchurch reporter Anand Zaki and cameraman Nathan McKinnon went to talk to those getting tested.
They lined up in their cars and in person, all the while keeping their distance from each other. The car park of Pack and Save Morehouse Avenue was busy, not with shoppers, but with those getting tested for COVID-19. Among them was Carol, who at age 71 is amongst the most vulnerable.
I haven't been out of my house since the 28th of February because my immune system's really bad and I'm trying to protect. Our daughter has been looking after us and getting groceries, and the test today is really quite horrible, but it's lovely they've come out on this cold day.
Another Christchurch resident, Bob, returned sick from the United States in January and tried to get tested at the time without success.
I did originally, but the tests were not available. They didn't have the swab, wasn't available at the time. Well, I think the idea of having it is excellent. Should be more of it, and it should have happened a bit sooner.
The Director of Public Health, Dr. Caroline McElnay, says the testing stations are part of advice the Ministry of Health received from its COVID-19 Technical Advisory Group. She says it is designed to increase confidence there are no undetected cases of COVID-19 in New Zealand, particularly in areas identified as hotspots for the virus.
So it won't be perfect information, but it gives us a snapshot of people in the community. And the reason that we chose supermarkets is because supermarket workers are in contact with a lot of people.
Captured in that snapshot will be Gayleen Ball, who wanted some peace of mind after a recent trip across the Tasman.
I just thought it would be a good idea to have a test. I'd been in Melbourne early March, and I just thought, yeah, if we get a test, why not? Best to know than not to know. No, I didn't even know it was happening until I was watching the 1 o'clock broadcast on the TV and they said they were doing testing. So I thought, right, that's me, yeah.
Running the Morehouse Avenue testing station was Pegasus Health Chief Executive Vince Barry. He says they initially planned to do 300 swabs, but ended up doing 400 and had to close up early.
Yeah, look, it's fantastic. I mean, this is the one thing I think in some bizarre way New Zealanders felt like they could actually, or Cantabrians could contribute to this whole lockdown stuff. And so it was really important for us and for the health system in the country to be able to understand the general population.
Vince Barry says the results from today's swabs are expected to be known within 24 to 48 hours. In Christchurch for Checkpoint, Anand Zaki.
And if you were listening to that on the radio, if you haven't seen one of those tests conducted, it is well worth going and having a look. We'll put it up online, that piece from Anand and Nathan, and you can see exactly what the swab test involves. New research has confirmed what Māori health experts have been warning since COVID-19 arrived on our shores. Māori are more likely to die from the virus than any other ethnic group. But now that New Zealand has seen the curve on the number of new cases flatten, does this still matter? Te Aniwa Hurihanganui explains why it does.
The government is expected to reveal the details around its $30 million COVID-19 health package for Māori this weekend. That's despite Māori making up just 11% of confirmed cases and having no deaths. It might seem as though Māori have already dodged the bullet, but University of Auckland statistician Andrew Spall says new research from Te Pūnaha Matatini highlights why we can't afford to be complacent.
The infection fatality rate for Māori and Pacific people is much, much higher. And the second important message is that those really high rates appear at younger age groups. So we're not just talking the over 70s, we're talking the over 60s. They are markedly higher.
The average life expectancy for Māori is about 7 years shorter than non-Māori, and their unmet healthcare needs are higher. Māori also have a greater prevalence of cancer, diabetes, heart disease, asthma and smoking. Mr Spall says the death rate for Māori over 80 with the virus is 3 times higher than non-Māori, and the rate is even greater for Māori in their 60s.
If you flip down to the next age group, it's 60 to 80-year-old. For non-Māori, non-Pacific, the infection fatality rate's around 2%, but for Māori it's 20%. It's 10 times higher, and for Pacific it's 13.5%. I mean, they're extraordinary differences.
If the virus does spread, the death rate for Māori could be higher still. The study didn't look into the impact overcrowding might have on the spread of the infection. Dr Rhys Jones from the University of Auckland says Māori and Pacific communities are more likely to be living in bigger bubbles, making them more at risk of transmitting the infection.
If the virus were to become established in Māori communities, there are significant risk factors in terms of social deprivation, things like household crowding, even the fact that Māori, and I think this also applies to Pacific peoples as well are more likely to be living in intergenerational or multi-generational households. That then exposes more higher risk people to potential transmission within their bubble.
The Ministry of Health released its initial Māori Response Action Plan just yesterday, which includes a commitment to fund Māori health providers. But Dr Jones says Māori communities, including those running safety checkpoints on the East Coast, haven't been sitting around waiting for the government to act.
The fact that, those communities, like we've seen up in the East Cape, have seen the need to take specific measures for themselves and kind of assert their sovereignty in a way to protect their communities, that sort of highlights that there have to be specific measures or different things done to protect communities that are particularly vulnerable.
The low number of Māori with the virus hasn't stopped targeted action from northern DHBs and Māori health providers to stop the spread in Māori communities. 120 Māori community health workers are expected to be deployed by the end of next week in Auckland and further north to ensure whānau know where to get help if they need it. Māori Health Lead for the Northern Region Health Coordination Centre, Aroha Hagi, says if the virus makes a resurgence, the impact on Māori could be devastating, so DHBs must continue to ensure Māori communities are protected.
We are really aware and concerned and have the same thinking in our minds about ensuring that our communities have the right support. This is part of the response. It isn't the only part of the response. I think we need to be ensuring that the whole entire system is responding to the needs of Māori.
Andrew Spall says the research highlights that there shouldn't be a one-size-fits-all policy to protect the country from COVID-19, and more must be done to protect Māori at a younger age. For Checkpoint, ko te aniwa, Hurihanga Nui, aho.
And just a clarification, the Southern DHB has been in contact to say they've had one additional person test positive for COVID-19 in their area, but that person was not picked up during random testing done in Queenstown. It was during separate testing. Now, the number of recovered COVID-19 cases is continuing to rise, overshadowing the number of active cases in many regions around the country. The Auckland District Health Board is reporting there are twice as many recovered cases as active ones, and many other DHBs are trending in the same direction. Wairarapa remains the only COVID-free region, and while a local mayor says it's a testament to people following lockdown rules, high testing rates helped stamp the virus out quickly. Annika Smith reports.
After reporting the country's first case of community transmission, Wairarapa is down to 0 cases of COVID-19. Its 8 cases, 6 confirmed and 2 probable, have all recovered in the community with no hospital intervention. South Wairarapa Mayor Alex Bayan is wrapped things are under control.
We're really looking forward to possibly being an early move out of level 4, depending on whether the country goes as a whole or region by region. But it's certainly, I think, a testament to the people of the Wairarapa and how they've reacted to the emergency.
Wairarapa isn't the only region seeing the recovered cases rise as active cases fall. The number of recovered cases in Bay of Plenty, Hutt Valley, Nelson Marlborough, Southern and Taranaki DHBs are all double or close to double the number of active ones. Mr Bayan says community buy-in during lockdown has helped stamp out the coronavirus, but there's another key reason.
The Wairarapa region had the highest number of tests done per head of population. I think that might have also been a cause for getting on top of things pretty quickly.
The Wairarapa District Health Board has enjoyed the highest rate of testing per head of population, with 20.7 tests per 1,000 people, followed by 15.5 in Waikato and 13.5 in Capital and Coast and Southern DHBs. However, speaking at this afternoon's briefing, Director of Public Health Dr Carolyn McElnay says there's no one reason why the Wairarapa is free of the virus while other regions are not.
There's no science behind why one place would have further higher cases other than others, but what we now are seeing across the country is a high level of testing across the country, so that's giving us a much better assurance that we're not missing any undetected cases.
And Finance Minister Grant Robertson was quick to add regional cases don't necessarily reflect what's happened in that area.
I do think it's important to remember when data is reported DHB by DHB that it doesn't necessarily pick up the point that Dr McElnay is making, that, for example, the Hereford Bull Conference in Queenstown is actually the source of a number of the Waikato DHB cases. So it's actually a little bit difficult to say it's about a particular region.
In a statement, Wairarapa District Health Board Chief Executive Dale Olaf says while she's grateful the region had a low case count, any reason as to why this is the case is pure speculation.
Wairarapa has done a great job of sticking to the lockdown restrictions and taking prevention seriously. Right now we have no active cases, so it's a matter of so far so good. But we are still testing symptomatic people daily across our 6 testing facilities, and it's too soon to suggest we have this virus beaten.
More than 74,000 tests have now been completed nationwide, and the government is rolling out a new round of testing targeting hotspot areas to see if COVID-19 is still circulating in those communities. Mō te hōtaka o te ahi nei, ko Annika Smith-Aho.
It is 19 minutes after 6 and you're with Checkpoint on RNZ National. We're now in week 4 of lockdown, and at this point many of us are struggling mentally. Lifeline says calls have increased by a quarter since the lockdown began, up from the usual 10,000 a month, as concerns mount over money, accommodation and relationships. So why at this stage of the lockdown is our mental health suffering the most, and what factors can improve? Louise Tanuth reports.
Since lockdown, over 600 extra calls a week are received by Lifeline. Everyone is struggling in some shape or form. The first 3 weeks have passed, but now with an uncertain finish line comes anxiousness. Clinical psychologist Dr. Dougal Sutherland says our routine has a huge part to play.
In those first couple of weeks, people got very busy with the doing. Now they've sort of calmed down. So I think there's boredom setting in perhaps as well, as people go, no. Gosh, I just wish this would be over now.
In order to cope and improve, it is all about pinpointing the real problem first, says Dr. Sutherland.
What is 1 or 2 things that are actually really missing? Then see if they can come up with a plan for how they can get into their life the things that are missing. And that might be physical activity, or it might be some sort of social connection, or it might be something to do with their mental or emotional health.
But he says the mental health impacts of the pandemic could last longer than the virus.
The mental health impacts of this could last for 2 or 3 years. So that's going to be, I think that's going to be a real challenge for the government in the long term.
Professor of Clinical Psychology at the University of Canterbury, Julia Ruckledge, has been studying the effect food has on managing mental health for over 10 years, with data from floods, earthquakes and the Christchurch mosque attacks. Results show food has a bigger impact than what we may think.
Nutrients are required for regulation of emotion, things like your serotonin or your dopamine. These really important neurotransmitters need these nutrients in order to be able to function optimally.
Dr. Ruckledge says in order to improve our mood, we need to change our next shop at the supermarket.
Your fruits and your vegetables, they're your nuts, they're your fish, your whole grains, those types of foods that are all typically on the outside of your supermarket. Ultra-processed foods only comfort you for a very, very short period of time, and then they actually perpetuate the problem.
Initially, the pavements were full of walkers and runners. Everyone was out exercising. But now many of us are falling out of routine and motivation is waning. CEO of Exercise New Zealand, Richard Beddy, says a lack of activity is a real concern.
If we're talking just about physical activity, we already have the 13th worst in the world. If we get too much drop-off and it happens for too long, ultimately that's going to cost us hundreds of millions, if not billions of dollars in long-term health costs. And so right now we're talking about coronavirus, but what we really need to be thinking about is overall the burden on the health system.
Richard Beddy says start small to get back on track and do it daily.
Whether it's getting up and walking the dog before you start work, or for that matter, getting up even if you're not working and going and walking the dog at 7 o'clock or 8 o'clock in a set time every day is a really important thing, because what it does is it helps to set both a routine for you, but also it really helps to kickstart the body, and that helps everything from the physical body, but also really important here is the mind and our own mental health.
Small steps to get us through these uncertain times. Mō te hotaka o te ahiahi nei, ko Louise Tenuth aho.
Living in the Jenkins household at Ohope Beach is like living in the land of the giants. Those are the words of Mark Jenkins, whose 3 sons, all rowing champions, had to rush home from their universities in the US when COVID-19 panic hit. And the travel dramas didn't stop there. Parents Mark and Maya were mid-flight as the global crisis unfolded. Now they're all home. They've settled into a routine that involves a lot of eating, study and exercise. Sharon Brett-Kelly reports.
Man, we can feel the heavy footsteps of giants as they're walking from their bedroom to the fridge, to the TV, back to the fridge, back to their bedroom, back to the fridge.
That's Mark Jenkins talking about his 3 sons, Lenny, 22, and 19-year-old twins, Elliot and Finn.
2 of them are 6'7" and one of them's about 6'4". I'm a tiny 6'1". And just feel like a complete midget, and me is about 5'11".
The daily routine starts before dawn because 2 of the boys have to hook up with their universities. Then it's breakfast time.
You'd expect would be maybe some wheat bix and milk or something like that, but no, there were about 10 sausages left over from last night, so they're all gone now. So we've had sausages and mashed potato with tomato sauce and bread for breakfast. But that's just the first course, so.
They talked me into buying them some Irvine pies the other day, so I succumbed to that because they don't get a pie in America. And I think Elliot and Finn had one this morning, and they reckon they were food of champions.
During their first 2 weeks in quarantine, Mia wanted to have a go at being sustainable and planted up a veggie garden and got in some chooks.
Unfortunately, the chickens haven't done very well. We've had 4 eggs, so they're not proving very professional ladies at the moment. But the chickens, 4 eggs, the boys are eating about, I think, 20 eggs each a week, so it's not making much of a dent on that.
Mia, an architect, and Mark, who has an online accountant business, both work from home. Most days, Elliot, who's completed his marketing and advertising studies at Boston for the year, goes to work on a dairy farm.
My routine is normally training in the morning and then going to work throughout the day, it's nice. It kills my day quite a lot, which is good.
Lenny's finishing his degree in political science and energy at Yale, and his day starts with a 5:30 a.m. seminar. Finn starts at 6 with full immersion German classes online with Brown University.
I'd rather be getting up and having breakfast first rather than having to put on a nice T-shirt over my pyjamas and speaking German so early in the day. Yeah.
All 3 have been rowing for their US universities, but the twins' goal is to represent New Zealand. Lenny's in the British national team and wants to have a crack at the 2024 Olympics, and that means running, riding or rowing up to 190 kilometres a week and lifting homemade weights.
I got a bit of rope and a bit of kayak anchor line, and I tied that around some bits of old foundation from the house, and I was using those. I think it was about 37 kilos, but since then I've actually been lucky enough to get sorted out with some Olympic bars from a friend of mine.
They're all grateful to be home together, but getting back was an ordeal in itself. While the boys were rushing to pack their bags and get on flights, Mia and Mark were caught out on the other side of the US. Mia went straight back home from San Francisco, while Mark continued on to London for work.
When I got to London, it was really quiet, and I just thought, oh, jeepers, I've made a real mistake here. So I went and got myself a beer and a curry and then organised my flight back to New Zealand. Yeah, the world was shutting down as I was flying home.
And I just watched Mark's flights inching their way across the globe, hoping like that he was going to, make it back okay. It was pretty scary.
The pandemic has thrown the brothers' study and rowing plans into turmoil, but the family time and a Kiwi diet of feijoas, pies and homemade bread make up for it.
I think I've got about 2.5 months of training solo before I go nuts, but I'd say everything will be all good by then, hopefully. Obviously, there are a lot of disadvantages and negative aspects of what's happening at the moment, but there are also positives as well, and I think it's good for us to sort of experience times together as a family that we definitely wouldn't have had otherwise, so we're definitely making the most of that.
For Checkpoint, Sharon Brett-Kelly.
And time for some feedback before we head off for the evening. This person says, I would like to send my kids back to school. I don't agree with this strategy. I think we should be isolating our vulnerable and allowing those who are young and fit to catch this. So slowly and safely the herd immunity develops. If I ever want to feel safe to visit my older parents, the safest bet for our family is to have caught and recovered from COVID-19, not cowering in our house forever while we become broke. We are ruining the economy for short-term safety. Long-term, we cannot eliminate this virus if we ever want to open our borders. When we do, this situation will repeat. So what point was all this economic and psychological suffering? No matter how much we flatten the curve, the number under that curve stays the same. No fast-tracked vaccine for my children, thanks. But John has got in touch to say, this is about our interview with the Education Minister, Chris Hipkins. You have to be barking mad, John says, to send your kids to school. With 10 kids in the class plus a teacher, you've just joined 11 bubbles together. How daft is that, John reckons? Let alone if you have more than one child going to school in a separate class bubble. Stay safe, says John. Anne Brower has been in contact from Littleton and says about whether or not we should come out of lockdown on Monday. When to come out of lockdown? 1, she says, because we have evidence of community transmission and our contact tracing is still not up to scratch. Ideally, 2 more weeks of lockdown, says Anne. She says it buys us so much more certainty of avoiding an outbreak and having to go back to level 4. The fewer cases out there, the better. If our team of 5 million can dig deep. 2, she says. If we can't, I'd move to level 3 on the 28th of April. Every day in lockdown buys schools and contact tracers time to upskill. I'm proud of New Zealand. It is better to try but fail than to fail to try. Good on us for going hard, says Anne. And this last piece of feedback, teachers will get children of essential workers, children whose parents can't help with their children's schooling and children who are not safe at home. If teachers think this is babysitting, then so be it. We will catch you on Monday when the big decision is made.
RNZ News headlines at 6:30. A petition calling for schools and early childhood centres to stay closed during Alert Level 3 has had over 12,000 signatures in less than 24 hours. The Education Minister says parents who have to go to work need support, and reopening schools is part of new ways of working needed under COVID-19. Up to 10 residents from St Margaret's Rest Home in West Auckland are being transferred to Waitakere Hospital due to staffing shortages. And 400 people have been swabbed at a Christchurch supermarket today as part of random testing for the coronavirus. Those are the headlines. Our next news will be at 7.
The citizens.
Oh, sorry, we don't know what's happened there. So let's go to Trending Now, our feature highlighting the stories you've been sharing via digital and social media ahead of today's edition.